Nicole, what do you think? Should we start?
I think it's time to go.
All right, let's start with some housekeeping items. And so just a couple of notes here. This is recorded. We record this for kind of our own quality assurance, like you hear on the phone calls. But also, if you want to share this with your friends or your family or whatever it may be that you might want to share this information with, or someone might find it interesting, you have the ability to do that. It will get emailed to you after the presentation. Also, there is a Q&A section here. Q&A, it's questions and answers, just in case. But in there, you can type in any questions, and we can either type back the questions to you if they're personal, or if they're a little more open, we can answer them kind of freely throughout the presentation. But also any feedback you may have for the presentation. Nicole and I always think of, Nicole, feedback is a gift. We always talk about this.
Nice
So
day.
yeah, so when she tells me I talk too much, it's a gift, and I probably need to be quiet a little bit. But no, I mean, we love to hear about how we're doing. Are we hitting on the right topics for you? Is there anything that really struck a chord with you, or anything that we didn't hit that you might want us to hit? That's what that Q&A section's for. All right, so we're going to go to the next slide here. And so I call this the slide of why do we deserve to be here to speak with you? So my name is James Kelly. I am the Chief Sales and Marketing Officer for Brio Living Services. And I've been in the business for, I think, 33 years now. I have to do the math. I got a year older this year, Nicole. It happens. I think I'm going to stop, though. No more. So I started out literally in this business when I was in high school. I worked for a developer that built retirement communities for not-for-profit sponsors across the United States. So I've worked with a lot of communities there and worked on constructing them and starting them. So seeing in ideal situations, how are things run? And then I also went and worked for ad agencies and did marketing and sales consulting for all that time. I've been with Brio now 7.5 years. So been here for quite some time now. And my thought process to this is I really like to be a resource to you. So this presentation is not probably as self-serving as you might expect it to be, even though I'm the head of sales. I have a life's mission of getting people out of their homes and moving into retirement communities, or even understanding what retirement communities really mean, that they're not your grandparents' retirement community. So we're here to help. And without further ado, we can introduce Nicole Mag.
Yeah, thanks, James. And I absolutely agree that the intention of this is to provide as much information and to be a resource for anyone who might need it. I think as a nonprofit in aging services, it really is our responsibility to be stewards, not only of our resources, but also the knowledge of aging services. So my name is Nicole Mag. I'm the Chief of Residential Services for Brio Living, which means I have the privilege of overseeing all of our communities. And Brio has 15 communities. We call it shore to shore. You might hear that word come up throughout the presentation. And that means that our communities span from one lake shore to the other lake shore across the state. And those communities range from all different care levels, all socioeconomic statuses, and different areas throughout the state. And believe it or not, Brio is actually only half made up of retirement communities. The other half of what we do is home and community-based services. So services that maybe don't happen in brick and mortar, but happen in a residence home in the community. But my expertise is in those communities. And like James said, I'm really very passionate about educating on this topic. I am a nurse by background. I started my career in the emergency room, and really that's where I developed my passion for this industry. So many times in that emergency room, we would see an elder come in inevitably on a Sunday night. They had just fallen or something had happened, and they're all alone. They're coming in at the ambulance, and I'm trying to call the family members, and I'm telling them your loved one's okay. They don't need to be admitted to the hospital, but they can't go home. And working through what that feels like for families and for the elders and not having that plan is really where I got to see firsthand how there really can be a difference between that proactive planning and trying to make that decision late on a Sunday night when it's really stressful. So when I was done with my time in the emergency room, I knew where I was headed, and I was going to head to senior living, and I was going to do as much as I could to learn and understand about the industry, but then also educate as much as possible. So I'm really excited to be here, and I just appreciate the invitation, James. Thank you.
You're welcome. So I'm glad Nicole talked about that, because one of the big things we talk about regularly is trying to make the decision, and the decision can be difficult to make. Also, when you need to make it, it is typically in a hurry. So hopefully you can learn a little bit more today about who we are and what we do, and what these terms mean, which are universal to all retirement communities. We have one question already. It says, are there any communities in Ohio? There are lots of retirement communities in Ohio. Unfortunately, we don't manage or own any of them. But if you do have questions about trying to compare something with us to Ohio, we're happy to sit down and talk with you too about contract types or whatever it may be. All right, so our first question here, what do you hope to learn from this presentation? So we'll give people a couple seconds here. Normally I do the do, 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 do. You know, everybody loves that little tune. It'll be stuck in your head for the rest of the day. All right, and so we have our guest on here too. Her name is Natalie. Natalie is the one that makes sure this all runs smoothly. Natalie is the one that keeps me in line most of the time. Okay, so Nat, how do we move forward? Do you give us the answers, or do we give them at the end?
Yep, we can share these here. Some people are still voting. If we want to
Oh,
give them another minute, we
give you a
still have
minute.
some votes coming in.
Great, thank you, Natalie.
And there's a little pause here, so I'm going to go ahead and end the poll. Thank you, everyone.
Great.
And
All
we
right,
do
so
have results, James,
here we
if you
go.
want to go through.
Yep, thank you, Nat. So what do you hope to learn from this? How to start the conversation with my loved one is 17%. Looks like the highest one is the differences in care options. Well, that's good, because that's what we're going to talk about a pretty good bit. How pricing works. We did a pricing presentation before this one, so we'll work through that a little bit, try to add some of that in as well. If my loved one will enjoy the environment, another big question. All right, so that's great. I hope that helps everyone else understand kind of what we're doing here as well.
Yeah.
Okay, so without further ado, Nicole, I think this is your slide.
Yeah, so I promise not to bore you with the statistics throughout this presentation, but I do think it's important to add just a little bit of color to why this is such an incredibly important topic. Like James mentioned, him and I have been in this industry for a while, and even in the years that I've been in it for the last 16 years, it's changed very significantly and very quickly. Not only did COVID come on the scene and change a whole lot of things in our industry, but we know that the demographics are shifting. And there's really three primary reasons why that's happening. The population is shifting. We know that the baby boomers are coming, and they're coming very quickly. We are seeing an increase in life expectancies, which is wonderful. But with that increase in life expectancies, that also brings the increase of risk or injuries or more chronic conditions that need to be managed for longer into the future. And so I pulled a couple stats from the Department of Health and Human Services, and currently they're predicting that half of older adults over the age of 65 are going to need some type of care into their older years, and that half of Americans turning 65 will develop some type of disability serious enough to require long-term care. Those are some really big statistics. And I know someone had mentioned, how do you start the conversation? And there's never a great way, but even leaning on statistics like this and talking about the likelihood that someone you love may need care in the future, sometimes having these numbers can really help. And we know that the number of older adults in the US is expected to grow substantially between now and the next 20 years. So if we know that the need for care and the need to be educated about care is incredibly important, what are the options out there? James, if you click on that next slide.
Trying.
Oh.
There it goes.
There we go. We wanted to be really fair and unbiased in this presentation, to James's point. Community living and community living at Brio is not your only option. You can imagine with a lot of baby boomers coming on the scene, there are very many organizations and people that are looking to this demographic and looking to provide solutions for these statistics that we just saw. So I wanted to share with you some of the options out there, even if Brio doesn't offer them. So say you are presented with a loved one who's maybe just starting to struggle. Maybe we're just starting to leave the stove on. Maybe you've noticed that there are some missed doses. Maybe hygiene is becoming an issue. Maybe care of their home is becoming an issue. And you start to wonder, what are my options out there? These are kind of the most common ones that exist. The first one is private duty. A good scenario for this is the one that I mentioned about the emergency room. Oftentimes, this is a solution that brings someone into your home. So private duty companies are not to be confused with home health. I know there's lots of conflicting information out there, but private duty are privately paid caregivers that will come into someone's home and stay with a loved one for a period of time. The pros of this, in my opinion, is the loved one gets to stay at home. There's no moving involved in this. And oftentimes it can be a bridge to a long-term solution. So if someone has a hospital stay and they can't go home alone, oftentimes private duty companies will be called in for a period of weeks or months until a longer term solution can be reached. That isn't to say that some people don't hire private duty aides to come in 24 hours a day for years on end, and that is a possibility. The cons, in my opinion, of private duty are there oftentimes is a minimum amount of time. You're not going to be able to have a private duty aide come in for 15 minutes to take out the trash or remind your loved one of a medication. There's oftentimes a 2 or a 4 hour minimum. And private duty can be very costly because of this. I think the average cost per hour in the state of Michigan is around $20 to $25 an hour. You can imagine if you're staffing private duty in the home at $20 to $25 an hour, 24 hours a day for the entire year, you're probably up over $200,000 for private duty services. So the cost can oftentimes be a barrier. It also can continue isolation. If your loved one's struggling with isolation, having a private duty caregiver in the home does provide some socialization, but it really just is going to be them in the private duty caregiver. And lastly, when you hire private duty, whomever is the family member or the support system is really the one who's managing that service. So if a private duty caregiver calls in sick, or they aren't sure what to do, or maybe it's not a great fit, the person that's getting the phone call is going to be that family member, and they're going to be expected to step in or manage through that situation. So oftentimes with private duty, it can be a lot to manage to have that consistently in the home. Another option that has come really in the last probably 10 to 15 years is adult day services. And it's much like what you would see for childcare. Essentially, it's a center where loved ones can come for the day. They can sometimes come for a couple days a week, 5 days a week. Traditionally, it's during business hours, but there are some with extended hours. The pro to this is that it is a hybrid. In my opinion, they have time in which they're in a center with other people, having a lot of socialization, and then time in which they can be in their own home if that's important to them. The cons to adult day is oftentimes accessing a site. Adult days are pretty centralized in big cities. You're not going to typically find them in rural areas. There has to be a lot of population density for an adult day to be successful. There is transportation typically. The loved one is driving their elder back and forth every day to the adult day. Some of them will offer transportation. And then just scheduling. Sometimes there aren't enough days open, or there's too many day requirements. So there is adult day, and that is an option. Obviously, there's always assistance from the family. And we oftentimes find that this is the most utilized service in the beginning. When a family maybe doesn't have a plan or isn't sure what to do, oftentimes the family will rally around and come up with a plan on how to support their loved one to stay in their home. Obviously, the pro of that is the loved one, if they want to stay home, they get to stay in their home and they get to have their family with them, caring for them. The con is oftentimes caregiver burnout. There's a lot of statistics about caregiver burnout. If you do a quick Google search, you'll see a lot of information about the impact of being a full-time caregiver and how oftentimes the caregiver will start to struggle more than the person receiving the care. It does continue with that isolation. If they're still in their home and they're just having visits from family or they're just with family, sometimes that can perpetuate that concern of isolation. And lastly, what we see is that it really starts to change relationships. Oftentimes, if we've had a daughter or a son or a caregiver come in and they're experiencing caregiver burnout, what they will say to us is, I just want to be the daughter again. Just want to be the son again. This has really changed the relationship. I've become a caregiver. I've become a handyman. I've become an advocate, and I just miss my mom or I miss my dad. And so that really can change the dynamic in a family when the family is the one supporting the loved one full time. Community living, obviously, I'm a big proponent for this, and we'll talk more about this in a minute. The pros, in my opinion, is once you've made this decision and once you've done the work to create the plan, it oftentimes is a plan for life. It's a plan that's created and will follow your loved one throughout their life. There's no managing of that care like we spoke earlier, maybe with adult day or private duty. If a caregiver calls in at, say, the Porter Hills Village campus, we are absolutely responsible for making sure that that shift is covered and that your loved one is taken care of. If your loved one is experiencing some health issues, we are going to be the ones calling the physicians, making sure they get to the hospital, make sure they're coming home. All of that managing of what it means to care for someone is handled by that community. And from a cost perspective, they're pretty controlled cost. Yes, we have normal escalation annually for cost of living and those things, but once you understand what the cost is going to be, it's a pretty controlled cost. You understand almost for a long period of time what those costs are going to look like, and there won't be surprises like, I don't know, a broken furnace or something that might happen in the home. Cons, oftentimes we have family members who will experience guilt or feel like they're making their family make this move. I think we see that more when family members are moving into the care levels directly instead of coming in through independent living. And lastly, hands down, and James will talk about this later, it's the actual move. The move can be really overwhelming. It's change. It's a lot of change. And we've found lots of ways to make this as palatable as possible, but the idea of the move can really be overwhelming for many people. Someone asked earlier or replied earlier in the poll that how do I know if my family member will like the community? And I immediately thought of this slide and how respite is an option. And this isn't something we talk about very often, and it feels a little bit like an insider industry thing that we know about, but respite is a short-term stay in the community. And what this is oftentimes there'll be a limit. We offer them at Brio. Lots of other communities probably offer respite stays, but it's a room in our community that's fully outfitted with all the furniture and all the fixins and all the things. And you can come for a much shorter period of time. Maybe it's 2 weeks, maybe it's 2 months, maybe it's 4 months. Sometimes it's planned, sometimes it's not planned. So maybe a family member is the primary caregiver and they're going on vacation for a month. And so they need a place for their loved one to stay where they're going to be well cared for and they know that they'll be safe. And so they'll have their loved one move into our community for the time period in which they're on vacation, and we take over the care and their loved one gets to experience the community for a period of time. And oftentimes I think that's a great way to really experience a community. And when it's unplanned, maybe the caregiver needs to have a knee replacement or needs to have or had a health episode. We need a little bit more time on respites. It's not like a quick couple-hour turnaround, but we can do a respite stay pretty quickly. And both of those allow you opportunities to stay in a community. So if you're exploring a community and you're really worried about are they going to like it, sometimes respite can be a really good option. And then lastly, I included it on here. It's hospice care. Oftentimes we get questions about hospice and how that works. Hospice care is care that can oftentimes be delivered in the home, but the resident or the loved one must have a diagnosis of less than 6 months to live, and they must be okay with not continuing life-saving interventions. So hospice can be delivered in the home. It can be delivered in a community like Brio. It can be delivered really anywhere that the resident is, and can sometimes be a really supportive option. It's just during a very specific time point in a loved one's life. So there are other versions of care out there, but these are the most common ones that people look at. And it's a really great list for you to kind of tick off from as you're struggling with this. Which one of these might make sense for you, and how can you get more information about them?
Yeah, Nicole, one of the things I wanted to add on here is that how I see kind of the pros and cons to these is the biggest part would be socialization. You could have someone come into your house, but the likelihood of socializing with them like you would with someone who's the same age as you or those kinds of things. I tell people all the time, it's okay if you want to stay home. A lot of people don't want to move to a retirement community. You love your home. Maybe your kids live nearby or whatever it is. Whatever, everybody is entitled to make their own choices. But socialization is a big one. And so if you do choose one of the options that keep you home, I think it's wise to plan to stay home. So if you have stairs, how are you going to get around stairs? If you have a kitchen that needs to be renovated, I think you renovate a kitchen earlier now. So that way you don't have to worry about it later. I make the joke that you go to sell a house and you paint the whole house and the house looks beautiful and you say, why didn't I paint this earlier so I could have enjoyed it? But you didn't. You painted it for the next person to come in. So you kind of change your mindset a little bit because it is going to be where you're going to spend the rest of your life. And so at that point, you got to kind of make it your own as well.
Yeah. Good point. And the key word being planning there. If staying at home is an option, that is a lovely option and it works really well for people. Just make sure that there's intentionality and a plan around how you'll be successful at home. So if we look at the next slide, we're going to talk a little bit about the care levels. And I know this presentation is very specific to the care levels, but in hindsight, I oftentimes think we probably should include independent living on this. And I want to pause there for a minute because James is going to talk in a little bit about the nonprofit difference. So I feel very passionately about making sure we have a plan and we're educating as many people as possible about our industry, but I also feel very passionate about the nonprofit difference. And one of those differences he may not bring up is the levels of care. So what's pretty unique to nonprofits is for us to have all levels of care in one community or in one organization. So as you're looking at communities and as you're exploring this is something really important to write down and make sure you understand. When you are talking with a community, asking them what levels of care do you have? Oftentimes what you will see in nonprofits is they may only have a couple levels. So they may have independent and assisted or assisted living and skilled nursing. And that's okay from a business model standpoint. But if our goal is to have a plan for the rest of your life, having all those levels of care, I believe, is incredibly important for that peace of mind. So I'm going to back up to independent living just briefly so that we understand what having all the levels of care means. So there is independent living. And on this slide, we just have assisted and nursing home. And what independent living means is, I know James will hate that I say this, but I oftentimes think of it a little bit like a condo, but way better, because you're going to have a home or an apartment that's going to be a few thousand square feet. It's going to look and feel just like your home that you came from. You may have a garage, you may have a yard, there's lots of versions of independent living that exist. And the key difference is that it includes housing, sometimes a meal plan. It will include all of your maintenance, all of your socialization. It'll include our fitness and our wellness and all of that. It just doesn't include care. So in a perfect world, if you were looking at community living, looking at independent living earlier and moving into a community before you need care is a really wonderful option, because then you know the community, you know how it operates, you know the people, you kind of fall in love with your community. And when and if you need care, those care options will be there. So I just wanted to highlight that. So what happens when you do need care? What does that look like? And what are all the different levels of care? So there's two main buckets. And you can imagine in the industry, we throw around all kinds of terms. For this presentation, we have two buckets: assisted living and the nursing home. So let's start with assisted living. And this is actually defined by the state of Michigan as housing, dining, and care. If all three of those things are being delivered under one roof by the same company, that's considered assisted living in the state of Michigan. And then, of course, within assisted living, we have a division called memory care. I think that this can be confusing as well. People believe that memory care is something separate. Anyone who offers memory care is offering assisted living. They're just offering a specialized version of that. So within our assisted livings, within BRIO, you may have your traditional assisted living, and we will have a memory care area. And in that area, the only difference is that oftentimes it's secured. And we have ways of making sure that that area is secure in case a loved one has some wandering tendencies. And we have specialized training, lots and lots of specialized training for our team members and for our wellness teams. So that's an important differentiation. Memory care is assisted living. It's just a division of it, just a part of it. How is assisted living paid for? Traditionally, it is private pay. So this is a monthly fee that you're paying for that's going to typically include everything: your care, your medication management, your food, your wellness, your engagement, oftentimes transportation to events. Everything is kind of wrapped into one monthly payment. It is important to note that there are other ways to pay for assisted living, not as popular, but there is some long-term care insurance, which will cover portions of it. So you're really going to want to talk when looking at assisted living about, do you take long-term care insurance? What does that look like? Do you take veterans benefits? The VA will oftentimes pay for portions of this too, and that's really important. And lastly, there are some Medicaid waivers in the state of Michigan and in other states where Medicaid will pay a portion of assisted living. None of those three options are the most popular. Typically, it's a private pay model, but they do exist, and it's really important for you to understand how that's paid for. So that's assisted living. So if I think of it as a continuum, which is what we call it, independent living is the most independent. Assisted living is when you begin to need care. Care being help with activities of daily living, which is the term we use: medication management, bathing, dressing, those actual care needs is when assisted living would come into play. If your needs increase to the point where you need medical intervention, that's when we move to the nursing home. And of course, there has to be two divisions within the nursing home to complicate that even further. But the nursing home includes housing, dining, care, and then medical intervention. That's when you're layering that piece on. So not only will you have all the staff that you would have had in assisted living and everything that you had in assisted living, you're now going to have physicians, nurses, and certified nursing assistants. There are certain things, ways that you qualify to be in the nursing home, but typically it's that you have a higher acuity diagnosis or you really need that medical intervention. And obviously anyone in aging services should be an expert in this and be able to support you in knowing, is it assisted living? Is it the nursing home? There's two distinct divisions of the nursing home. There is what we call rehabilitation. And this is when someone goes into the hospital and just needs to come in for a short period of time to rehab and they are going back home. So you may have heard of someone who went in and had a hip replaced, and then they quote unquote went into the nursing home for maybe 2 weeks, had a bunch of therapy, and came home. That's what we call rehabilitation, and it's all under the umbrella of a nursing home. Typically, that's paid for by their insurance, Medicare or a version of Medicare, but they're coming in, they're getting better, and they're heading back out. The other version, which I think most of us think of as the traditional nursing home, is when someone comes to live with us. And that is someone whose medical needs are to the point where they need full-time, 24 hours a day nursing home support, and they live with us. And that's typically paid for either privately or Medicaid. Those are really the two ways that nursing homes are paid for. And I think sometimes nursing homes can have a negative connotation, but I can tell you that I've spent a lot of time in nursing homes. There's some pretty amazing, beautiful nursing homes. And so I encourage you to get out, tour them, ask about their philosophies on care. There's a lot of beautiful nursing homes in the state, and I think you would maybe be surprised at what a nursing home looks like. So those are the levels of care: independent, assisted, and nursing home. So next slide.
All right. And then I think this is me.
Yep, nonprofit difference. I promised it was coming.
Yep. And one of the things that Nicole was talking about when we're talking about how things are paid for, that was a big question that we had earlier of how to pay for that. And when you understand it's out of pocket, that means, you know, you are paying for that on your own. And so I thought this would be a good transition to understanding what is the mission of the organization that is providing that care. So in the care world for assisted living, I would say independent living, assisted living, and skilled nursing, although most skilled nursing now is not for profit because it's hard to make money at skilled nursing nowadays. There's two main schools of organizations that provide that. The first one is for profit. The second one is not for profit. The for profits are basically kind of exactly as it sounds. It would be someone like Nicole and I may come together and say, hey, we want to start running our own assisted living community. And how do we do that? Well, we would borrow money. We'd have construction loans, and we would build the building, and we would control how it's operated. But at the end of the day, Nicole has kids. I have kids. We're going to want to make money off of this. It's an investment. And so if we make money at the end of that year, that money would go to the investors' pockets or shareholders or whatever it may be. Does it mean that Nicole and I have a bad mission? No, it doesn't. But it does mean that we're going to look at the bottom dollar on a regular basis to make sure that we're making money. Now, the not-for-profit is a little bit more interesting in the fact that it's not a nonprofit. A nonprofit, these terms are used interchangeably, but for a basic understanding, the Alzheimer's Association is a nonprofit. If they did not get funds coming in through philanthropic efforts, they would have no income. They have no revenue stream. So we call ourselves a not-for-profit because we're running this organization not for profit. We're running the organization because of the mission that we have to take care of people. Now, the question always comes up, do you make money? Yes, we do make money. The difference is that money that we make, if it's $1 million a year as an organization, that money goes back to our organization. It goes towards capital expenditures, goes towards creating better benefits, better pay, whatever it may be, but it stays within the organization. And that's really the big point there. One of the other key points to a not-for-profit is because we are so mission-driven, we are a government-issued 501c3, that is a designation for a not-for-profit. It means that if you went online, you could find our financials. We are required by law to post our annual reports. If you move into the community, we are required by law to give you disclosure statements, those types of things. But really, I think the big one is called benevolent care. And what benevolent care means is that if you ever do deplete your assets due to no fault of your own, which means that you moved in and you were 80 and you happen to live to 99 and you didn't plan on living to 99, that you outlived your assets and you didn't give your money to your crazy Uncle Larry, we're never going to ask you to leave. And quite frankly, I know Nicole and I feel so strongly about this that I would say we donate money out of our paycheck every 2 weeks to go into the Benevolent Care Fund, because that's how much we believe that no senior should ever be asked to leave an organization because they can't afford to live there. And that is something that definitely comes out from the not-for-profit difference. Nicole, you think I got everything there?
I do, and I think that's another question as you're developing your questions and you're going out to communities to really understand if something happens and we run out of money, what happens? Will we be asked to leave? Will we be that's something really important to understand. If the move is one of the hardest parts, you don't want to have to do that again after you've already done it. So I think that's incredibly important. And James, we actually have a question in the chat that I'm going to ask you while you're talking about pricing.
Sure.
So one of our participants asked, is there an entrance fee for independent living? What does that cover? And is there an entrance fee for assisted living?
So entrance fees are pretty much for the independent living portion. They are the larger residences, those kinds of things. Most people fund that with the sale of their home and transfer those assets into the community. An entrance fee actually is also refundable in some way, shape, or form. It could be 50% refundable. It could be 90% refundable. There's differences in contracts for that. Now, we're talking about levels of care. In assisted living, there is no entrance fee like that. It's basically a monthly service fee, and the monthly service fee is what pays for the monthly expenses of that month. And that is your caregivers, food, electricity, insurance, benefits, all that kind of stuff. And then that's pretty much what that covers. And so you're going to pay a little bit more for the assisted living because you have all those extras tagged on there. And then one other thing our organization does that a lot of others don't is when you pay the entrance fee, when you live in independent living, when you move out of independent living and go to assisted living or skilled nursing, whether it's at our campus or another, you get your entrance fee back. That helps you pay for your long-term care. A lot of organizations keep that entrance fee until you physically move out of the building, which means you would have to go into investments to pay your monthly service fees and those kinds of things. But that's another difference that we make as well. All right, so moving on here, we want to talk about assisted living, and when we talk about its private pay, we want to really look at how does this work. So there's two real types of private pay contracts out there for assisted living. One is called tiered level pricing, and that means that you may have someone that moves into assisted living and they really just need maybe some med management, maybe some oversight while showering, maybe a little bit of help bathing or dressing, but they really don't need a lot of help. And so we price that accordingly through 3 different tiers. And so if you require the highest level of medical help or even just assistance while you're in assisted living, you would pay the highest rate. So it depends on where you are of how much you would pay. Then there's also the all-inclusive rate. The all-inclusive rate means that you don't have to worry about what level of care you're in or going up or going down. Everybody pays the same rate. Everybody gets the same amount of love and attention. Now, why is this important? This is important because some organizations will charge you for a basic room rate. And so this is typically a for-profit model. So they may charge you, I'm just going to pick a number, $1,500 a month for a basic room rate. And then if you want to add med management to that, that might be $500 a month. If you want to add bathing and dressing to that, it might be $50 every time you take a bath or a shower. If you need help dressing, if you need help with other things, it just starts to snowball on. I knew a lady that ate ice cream every day after dinner, and she moved to our community, and she used to live in a for-profit community. And she said, they used to charge me $7.50 every night when I got ice cream. If someone in our community wants ice cream every night, we're going to get them ice cream every night. And it's not necessarily really a tiered level thing or an all-inclusive rate. It's really just that's how we do business. And so there's where you see some of those differences between for-profit and not-for-profit. But honestly, when a lot of people come in, their rate, I should say their care levels are much higher than what people normally think they are. Because when people move into assisted living, they try to stay home as long as possible. which means that when people come in, they're typically a little bit more, they're a little bit more frail and a little bit older. All right, so here we go. We have another question here. Do communities like Brio for independent living guarantee availability of assisted living or long-term care if and when needed? We do. I think it depends a little bit on where you're at. We offer a lot of different types of communities. We have some affordable housings and things like that. When you're within the Brio family, you do have priority access to assisted living, memory care, and skilled nursing from anyone on the outside. So if you live in an affordable housing apartment and you need skilled nursing, you would come into the skilled nursing either at, well, I'm going to show you in a minute here, but Porter Hills Village or Chelsea Retirement Community before anyone would from the outside. So that is definitely a bonus for that one. And so to try to show you here, when you talk about tiered level pricing versus all-inclusive, Porter Hills Village, which is in Grand Rapids on East Fulton Street, that is tiered pricing. And then Chelsea Retirement Community and Meadowlark Retirement Village, those are both all-inclusive pricing. So when you move in, you pay one rate, that's it. You don't have to worry about it anymore, and everything is taken care of. So as we move on here, we have another poll. So I want to try to, oh, I got to change the screen here first. There we go. All right. So the question is, what are you most concerned about with your loved one remaining at home? So good question. A lot of people share different concerns for different things. Some people say, well, mom can cook, but I'm really worried about her leaving the stove on, as Nicole said earlier, or making sure you take your medication. Things like that can definitely help. Social isolation is a big one. Falls are a big one. I hear a lot of people say, well, I live completely by myself. Oh, do you cut your grass? No, someone comes to cut my grass. Who does, you do grocery shopping? No, I do, grocery shopping's delivered to the house. Oh, okay. So are you cooking? Well, kinda. I eat a lot of TV dinners, which I don't even know if people call them TV dinners anymore. Frozen meals, I guess. And the interesting thing about frozen meals is they're actually not very healthy. I have high blood pressure, number of medications, forget to take my medications. Actually, I forgot to take them today. So that med management thing on there, I know Nicole always yells at me about that. But they're very high in sodium and they're also not very healthy. So, there's different types of things here that we worry about. All right, Nat, do you think we have all the answers? Here we go. Wow, this is really cool. So the tie for first place at 42% is social isolation and falls. That's what people seem to be the most worried about. Dressing and hygiene and medication needs both tied also at 8%. So very interesting that social isolation is a big one. And I wonder if that's because we talked about it earlier and planted the seed, or if that is truly something that's out there. So that's really, really neat that people see that, because it plays such an important role. Like Nicole, remember during COVID, and it was hard to see your loved ones, and that kind of thing is really tough. Okay. All right. This gentleman said, I didn't answer the question. Priority over those coming from outside is not a guarantee advanced care will be available. Well, advanced care would be the assisted living or skilled nursing. So we are guaranteeing that the care will be available. If you're referring to how it's paid for, that may be a different story. There is no Medicaid necessarily. There's Medicaid waivers for assisted living. Those are few and far between. But in skilled nursing, we are Medicaid eligible. And what most people do is they stay home as long as they can. And then by the time they do come to the community, they go to skilled nursing and Medicaid. So I think that's kind of the key point there. So, all right, let's go move on here. All right, Nicole, is this me or you? I don't remember. I think
It's a little bit of both of us. So this is what I was talking about earlier with the move. And oftentimes James and his team sees it more than operations does. But the idea of moving can be so incredibly overwhelming. Maybe your loved one has lived in their home for 40, 50, 60 years and has collected many, many things. And so one of the things that senior living communities I think, have done is really perfected in the most it can be perfected, because nobody likes moving. I don't like moving. James doesn't like moving. We inherently do not want to move or change oftentimes, but we've done a really good job making it as easy as possible. So I think James is going to outlay what a move would look like to hopefully decrease that feeling of being overwhelmed about that.
Yep. So the first one is, and I tell people this all the time, this decision is about 25% rational. If it was a rational decision, you would say, this is my square footage, this is how many meals I get, and this is what it costs. And so you'd have a cost per square analysis and say, this is where I'm going to go. But it's 75% emotion. And that emotional part is when you walk in and there's marble on the walls and marble floors. A lot of people go, this doesn't feel like home. And so if you go to a community or an organization that has carpet and warm colors, or maybe some woods or whatever it may be, you may go, that feels like home. And that may vary per person according to what you like, but it depends on how you feel when you walk into the community. That's kind of the biggest thing. So you want to tour, you want to talk to us, you want to learn about us. I tell people all the time, no one makes this decision on their first visit, so don't feel like you have to. When you come out to see us, even at events, we call that a taste of who we are. If you like what you're saying, if you like, on it, quite honestly, what Nicole and I are saying today, and our attitude towards care and how we describe it, then you'll go, you know what, I trust those two. Let's take the next step. Let me go there and try the food. And then you go, well, I like the food. The food's good. Okay, what's the next one? I would like to see where I'm supposed to live. Well, the nurse was really nice, or the care aide was really nice when I was there. These are the steps that it takes to try to help you figure out what you want to do. The next big part there is the health assessment and approval process. Basically, we're making sure that we can make sure that we're taking care of you in the best way possible. So we create a care plan and make sure that we can take care of all your needs. And then also, like, are you approved? And this is another big difference between a for-profit and not-for-profit. We run a financial analysis on everybody that moves into the community to make sure that either A, you have enough money to live at the community for your lifespan, which means you would be covered under the benevolent care policy, or B, if you don't have enough money, that you would not qualify under the benevolent care policy. And so then we try to help people try to find a place that may suit their financial needs a little bit better. But this is where we have to stay in business. There is no mission without margin. And if we can't make sure that we allow folks to move into the community with financial means to live their lifespan, then we're going to be out of business pretty quick taking care of folks. The next part there is we make this move as easy as possible. There's two company names down here: Seniors Moving Smarter and Pathway Movers, Senior Movers. And so both of those organizations specialize in moving seniors. So they'll go through your house or your condo or whatever it is and say, what do you really want to take with you? And if your scissors are in your nightstand drawer, top drawer at your house, when you move to your apartment or your assisted living or whatever it may be, they'll make sure your scissors are in your top nightstand drawer, those types of things. And then once you move in, we really work through operationally. We talk about how do we orientate you to the campus? Where are things at? How do you ask for things? What do you need? If you need help, how do you get it? And then talking about care planning, like, okay, you have to take your pills every morning. What time do you like to take your pills? Well, I'm a late sleeper. Okay, so what if we came in at 8:30 instead of 6:30 to make sure we get your pills? So, we're working around your schedule on that as well. All right, so continuing through. All right, so now we're going to talk about assisted living myths. And so this is kind of neat because we enjoy hearing what people think assisted living is, and then we try to answer it from that standpoint. So I have the first myth. I'm waiting for it to come up here. Okay, assisted living is too expensive. All right, if you were to look to compare the cost of in-home care compared to what it costs to live in a community, I think you would find that it's actually much more expensive to live at home. The numbers that Nicole gave for $20 to $25 an hour, that is a very true estimate of what it costs. If you look at McDonald's is paying $17 an hour, You're going to want an employee that is going to take care of you and really take it seriously. So they're paid more. That is becoming an art of caregiving nowadays as well, which truly is great that people are taking care of people that because they want to, not because they have to. So that's really nice. And then when you consider everything that's included, your utilities, your meals, activities, socialization, all those things included, it's really not more expensive. It's actually less expensive than living at home. So what do we call that? We call that myth busted. All right, Nicole, you get the next one.
Dramatic. Yes. So another myth that we hear quite often is, but if I move into a community, I will lose my independence. And this makes me think back on my career, and I think of how many residents I've talked to throughout my career, and never once have I ever had a resident say to me, I wish I would have waited longer. If anything, I hear, I wish I would have done this sooner, more often than you can imagine. And I know that sometimes this can be hard to believe, but moving into a community isn't a loss of independence. It might feel at the time like a loss of control or a change, but if anything, you gain more independence by living in a community. If you think about the things that we don't enjoy doing, the things I don't enjoy doing, my home maintenance, maybe managing medications, like James said, doctor's appointments, paying all of the bills, worrying about the property tax, all of these things that I don't enjoy. And then you think about living in a community where we take care of all of the maintenance requests. There's a wellness center and a gym, likely on site with trainers. There's amenities like wood shops and salons and a physician clinic that maybe you can go and see your doctor right on site. You can be engaged in a million resident groups and resident activities. There's a restaurant, there's a coffee shop. All of that is under one roof. And in most cases, one price. That really takes a lot of the worry out, and you really get to just start living and enjoying your life. So the last thing you lose when you move into community is independence, in my opinion. And once you move into a community, that's not something we ever hear from our residents. It's not, I wish I wouldn't have done this. It's oftentimes, I wish I would have done this sooner. The other thing that's really important here is that there are different philosophies in resident care, to James's point. And one that we're really passionate about at Brio is resident directed care. And there's a whole philosophy about that and trainings and things that we invest in, where really our residents are at the center of what they want their days to look like. Breakfast on a rising, not at 7 a.m. or I want ice cream every night. We work really hard, especially in our care areas, which is what we're talking about today, to care plan around the residents' direction and what they are looking for. And I do believe that's culturally important, but also oftentimes can be a nonprofit difference, that really strong investment in resident-directed care. So I would say that this myth is also busted.
Good job, Nicole. All right, the next one, the food is bad. I got to tell you, these pictures, all three of these are actual pictures from our communities. And this is very indicative of the food we try to serve. They are professionally trained chefs. These are chef-run kitchens. This is not cooks in the kitchen. This is not a cafeteria. You're not carrying around a tray. This is chef-run dining. Actually, it's so much chef-run dining that in many cases, the meal that is served for assisted living or memory care, a little harder with memory care sometimes, is the same or similar to what is served in independent living. And so just because you need a little bit of care doesn't mean that you're still not interested in having, you know, that one picture there, a nice little piece of filet with, I don't know if that's a carrot or a rutabaga, probably not a rutabaga, maybe a sweet potato. But you know, the difference may be is that in assisted living, you might have to have that help cut up for you. But that again is something that we work with as well. But we make sure that we have delicious food. We also have people there that are working with you through your diet. The dietitians are great. So the fact that someone would say the food is bad, that is also busted.
I will say we have really good food.
Really good food.
Yeah, and a lot of communities do. So I don't want to say it's just Brio, but you'd be really surprised how good the food is and the creativeness that our teams do. So Someone asked earlier, will my loved one enjoy it there? Will there be anything other to do besides playing bingo? And I want to be really clear that that is not the case. And in fact, this would be another area that can be really misconstrued, and that we actually have dedicated wellness and engagement teams on campus that are trained, that are college educated, that do nothing but focus on the dimensions of wellness. And there are, we argue, between 7 and 8 dimensions of wellness, and we address those individually for our residents. So for example, emotional wellness, we have social workers on site, we have support groups, not only for our residents, but for family members. And so there is a lot of various wellness and engagement activities that isn't just birthdays and bingo. Spiritual, this is another one. All of our campuses have some type of dedicated chapel or spiritual space. We'll have a chaplain on staff. Our bigger campuses have multiple chaplains on staff. Intellectual, we constantly are bringing in outside colleges or heading to the colleges or having speakers. If you want to continue to learn the rest of your life, there is no shortage of those opportunities in our campuses. Physical, like I said, we actually partner with a company called the National Institute for Fitness, which handles all of our training and physical classes. So we have chair yoga and chair volleyball. We have pools on 3 of our campuses. So a big focus on the dimensions of wellness, and probably really much more than what you're thinking of when you think of bingo. One of the things you can ask for when you're touring communities, and I recommend that you do this, is you ask them for their monthly calendars. What are the activities going on? Can you give me your monthly publication? That'll really give you a quick window into all the opportunities and what they're offering in the community, as well as what you can expect when your loved one moved in. And that might be something that you could bring home to your loved one as you're looking at communities, and have them just peruse through the activity calendars or their communications and say, what gets you excited about this community? So definitely this one is busted.
Good job, Nicole. Agreed. Couldn't say more about that one. I will say though, I really enjoy bingo. I can't mock it. I really enjoy it.
You
And
know?
birthday parties. Who doesn't love birthday cake? I mean, really, that's really what it, but there's so much more. I agree.
There's so much more. We
So
will
much.
play bingo. We absolutely will.
All right, so what's the next step? So we've got some questions here for you. So what is your next step? What do you see it as? Researching community websites, investigate home care options, tour a community, take a personalized survey. I'm doing nothing. That's an option. Or other. Maybe the other is all of the above, not sure.
Mhm.
But let's see what the poll comes out on this one.
And while you look at these, someone had asked in the chat what the difference between Medicaid and Medicaid waiver is, and I know we skimmed over that very quickly. And I am not a Medicaid expert, and there are many experts in the state. Specifically, there's a lot of attorneys if you're looking at Medicaid and applying for that, and that's where we would send you. But the core difference between Medicaid and Medicaid waiver is what they cover. They all require an income level that is lower than certain poverty levels in the state, and it all is based on income. But traditional Medicaid will cover oftentimes your medical expenses, where Medicaid waiver will cover more of those home and custodial expenses. So things that aren't medical, but are still supportive. So how that can look is oftentimes maybe you get 4 hours of Medicaid waiver, which would be a private duty aid paid through Medicaid to come into your home. And sometimes assisted livings will also offer that piece where you can use your Medicaid waiver in the assisted living.
Mm-hmm. All right, so we should be getting our results shortly. Nicole, thank you for that. That's not an easy question to answer. All right, Natalie, are you going to give us the answers? Hey, there we go. Okay. All right, 42% tour a community. That's great. Love that answer. 25% is tied with research other community websites, and then other. I'll take other as all of the above. Then we're at 8% for investigate home care options. That's pretty cool too. I like that. When you tour a community, make sure that you are ready to ask questions that are very important to you. Make sure that you can look at the financials for the organization that you're meeting with, that the square footage meets what you're looking for. I know for our sales team, we really try to take the time to sit with you one-on-one and learn about you and be able to give you a personalized tour. It doesn't mean that we're selling you. I make this joke all the time, and that is, if we talk you into living there and you don't like it, we see you every day. So if you're not happy, we see you every day. And so we don't want that either. So I'm glad that that we get through that too. All right, so going to the next slide. This is a quick little survey. If you're trying to think of maybe what level of care is right for you, so when is it the right time for senior living, you might want to take your phone and take, you know, on the camera and tap the little yellow button that takes you to that survey. Or is it the right time for memory care? What I can tell you is most people don't come to us saying I need memory care. They come to us looking for assisted living and say, but mom does have some memory issues. But that doesn't mean that that person is able to live in assisted living because they might be too far in need of care at that point. And sometimes people that do have some memory issues, when you transition them from where they live to a new environment, sometimes they don't do so well with that as well. And so you might have to go to memory care where people are trained specifically for those diseases, quite frankly. All right, so I'm going to move on from that. This is a quick little guide and key that tells you what is at each community. So whether it's independent living, assisted living, memory support, long-term skilled nursing, short-time inpatient rehab. We also try, and this is what we were talking about before, so Cook Valley Estates and the Cedars are really good examples of this. We don't have anything but independent living at those campuses. But the Cedars is about 7 miles away from Chelsea Retirement Community, and Cook Valley Estates, as the crow flies, is about a mile away, but you have to go kind of around the bend a little bit. So it ends up being about a 5-minute drive, but they do share all of those care levels there. So if you're looking for any of these, is a little key for you. And you can always feel free to ask us, which leads me to the next slide, which is, if you're looking to communicate with us, this is a great way to do so. If you have any questions, want to come out for a tour, if you want to say that Nicole is a really bad presenter and that James should do it by himself all the time. Why do I feel like it's the other way around? My jokes aren't funny, Nicole's are. But any feedback you may have there, these are the emails, addresses, and also the phone numbers for those. So I want to check here and see, oh, did I take away that last slide? I did. I want to see if there's any more questions coming up. So I'll just give you a couple seconds here. A reminder, we did record this. So this will stand up in court, Nicole.
Of course it will.
I love the tease, Nicole. But no, you will have this sent to you by whatever means you reserve this by. So I would imagine it's through one of our communities. So this will be emailed to you and your family or loved ones can watch it, or you can watch it again if you think you missed something. But it doesn't appear that we have any questions. We answered, I believe, all the questions that came up either live or through typed responses. So thank you everyone for attending. Nicole, thank you so much for your time and your expertise on this. I believe you gave better explanations than I do. So thank you very, very much.
It's my pleasure. And thank you everyone for attending. I think that sometimes just becoming educated is incredibly valuable. So I commend you for taking the time to listen. Thank you, James.
Thank you. Bye, everybody.